as far as knee valgus, we've talked about knee valgus a lot on like dynamic knee valgus, because so many jumpers do get to some degree of it in a standing vertical jump. But as far as like your structure, you've always been valgus. Is there something that you can do about it? How curable is this without surgery? Do you think that it's kind of one, is it a problem? And two, is this something that you feel like you can really change?
I think knee valgus gets a bad rep because naturally the human body actually has a degree of knee valgus. If I were to just stand up, you look at a skeleton, just bones, the knees have this inward sort of V curve, and that's totally normal. But also when we jump or when we squat or when we do anything that requires internal rotation, then we should have a very slight degree of knee valgus or more, depending on how, let's say, how deep that cut is. Then your knee is going to go inwards. If it doesn't, you're not going to be very agile. So when this internal rotation needs to happen, when we produce force, then that is not necessarily a problem, because what should be happening under normal circumstances is the femur internally rotates the leg bone, coupled with the shin internally rotating, coupled with pronation at the foot. Those are normal mechanics. So if I see someone that does that, if I see someone who has that internal rotation all the way down, the foot pronates, then I'm going to say, okay, that's probably not necessarily a problem. We see this with basketball players a lot. A lot of them have that push and their knee goes in, but you never see them necessarily get hurt. Look at Kyrie Irving. He does it all the time. Crazy handles. His knees are in all the time. But yeah, he has some knee issues, but he's not always hurt.
Yeah.
And I don't necessarily think it's because of that. I've never assessed Kyrie. Maybe he doesn't do it very well.
Well, Allen Iverson too.
Really
Iverson. Anybody who's extremely shifty,
Yeah.
Kemba Walker. I mean, anybody who's extremely shifty, you're going to see those knees going in a lot.
Yeah, it's very common in basketball athletes.
Yeah.
Very common in baseball athletes as well, or really a lot of sports. Football athletes,
Yeah.
that those knees go in, and I think that's okay. But it starts to be an issue if you're seeing things fight each other. Let's say the femur is going inwards, but then the shin bone goes outwards. That's what we refer to as knee valgus. These things are now torqued, and there's rotation happening that is opposing each other. And then you've got this, and then the knee goes inwards. That's when you start to see those ACLs go, those MCLs, other knee ligaments, the meniscus. That's when you start to see those issues. But again, you also see people do this all the time, and it's not the prettiest thing ever, but they don't have any injuries. So I always come back to this question of, if they're a great athlete, how much should we intervene with their mechanics?
Right.
It's the eternal question, I think. But in terms of addressing it, I think the number one thing we can do is build resiliency within the tissues, within the ligaments, within the tendons, within the musculature around the knee. So you better be good at doing plyos. You better be good at multi-directional plyos. You better be able to handle eccentric and concentric forces. And I think that's the number one thing we can do. I actually think mechanics are secondary to that. Mm-hmm. Also, making sure that you got the basics taken care of. Are you sleeping enough? Are you taking care of your nutrition? Because I think we can start to think about the mechanics, but people are so much more prone to injuries if they don't take care of those basic things first. But in terms of the mechanics, I think we can start to restore variability to the pelvis and also the foot. The foot is supposed to be more of a mobile joint, the knee more stable, and then the hip more of a mobile joint. So if our pelvis and our leg can go through the necessary internal and external rotation when appropriate, as well as our foot can go through that pronation and supination when appropriate, then I don't think that knee is going to have a reason to cave in too much, because that knee isn't going to need to compensate, because knee valgus is a compensation for a lack of mobility properly in the right context. So if we train that femur, hip, and also foot to go through the appropriate joint actions together, then I think, and I believe, and I have seen that we can actually reduce this knee valgus, because we are going to train that to happen at the right time and under the right context.
Right. 100%.